So with that, we're going to turn to our next employer. I'm so excited to have the Fairview team on. The Fairview team is going to be answering all of your questions, so feel free. And once again, if you have been inspired by the employers that you've seen thus far, Children's National or ECU Health, you can apply on our website, amnhealthcare.com/international. Our recruiters are on hand, ready, and excited to hear from you. All right, so good morning to Tanya and to Michelle. Great to see you both. Let's take a quick minute of introductions. Tanya, you want to go first?
Good morning. So I'm Tanya Vlasiak, and I am the manager of workforce clinical partnerships here at Fairview. And what we do is we are working with our international partners with Connetics and AMN to hire individuals that could work within our healthcare facility. So welcome to Health Fairview and Ebenezer. Health Fairview is a part of a continuum of care where we have the University of Minnesota, UMP partners, as well as we go into assisted living, TCU, and elderly care. So today it's Michelle and I are presenting with Maria Rains. Maria Rains is our Chief Executive Nurse Officer. She was unable to come. She got laryngitis at the last minute. So as you know, these Zoom calls, we just kind of move it through and we work through. We're going to show you a presentation, and hopefully this will come through as well, about our Health Fairview and our facilities. Okay.
There are very few things in history of mankind that are as glorious as medicine. But healthcare in the United States, not to be pessimistic, is broken. We can handle the healthcare market in a smarter way. We have so many good willing people, so many smart people. We will own the complexity and recast how we look at healthcare.
This gives us a huge opportunity to continue to advance a healthcare system that really works for people. That's why we're here, is to make sure that we're continuing to serve the citizens of Minnesota, to make sure that they have absolutely the highest probability, the best chance of being healthy. We're building it. We're building it today. We're building it together. It's not impossible.
How would you fix healthcare?
Oh gosh. I don't know. I want the best healthcare for my kids, but I don't want to waste a lot of time driving around trying to get it.
You might read about some cutting edge research. How does that get down to us?
The resources need to be easily accessible.
It's like the discharge process.
It's not very easy to get there. It's to take off time for work.
Help me and show me where I need to go.
A little love could go a long way.
Healthcare does have a lot of little hassles.
But by combining Health and Fairview, we're getting the best of both worlds.
I think that we're breaking barriers
to the best care and the best treatment.
Everything comes together. The hospital, the medical school, the research center.
The cutting edge research translates
all the way to the clinic in one seamless line.
It's using the things in science, the front lines, the things that we have that no one else does.
That's where healthcare has to go.
We're doing a lot of little things, even things behind the scenes, like collaborating with other teams.
Be it virtual visits or home care visits.
How can I get you the right kind of advice, the right kind of guidance using technology?
Even something like staying on schedule, staying on time makes people feel like their time is important.
From concierge to clinic coordinators to doctors, we try to keep it smooth as ice.
We want the patient to feel supported.
Compassion is the heart of everything that we do.
When I go into a room and there's a baby being born, I cry when they cry.
Empathy is very important.
Because love is what you're going to need to heal.
We're building it. It's happening.
That's what we're doing every day.
Healthcare seems too big to move, but we can move it.
We're an academic healthcare system, and we are world known for transplant and research. And we would be excited to have any of you come and check out our positions and consider working amongst our other RNs here at Health Fairview.
Why consider Health Fairview? As Michelle said, we have 32,000 employees here at Health Fairview, as well as with Ebenezer. So one of the opportunities in Minnesota is it's the ability to look at our healthcare from birth all the way to old age. And in Minnesota, we're located in the middle of the United States. You can see it in red here by Canada, the Dakotas, Iowa, and Wisconsin, right? So we have 4 seasons. It's beautiful in all 4 seasons. It's something to experience. And yes, we do have snow. Yes, it gets cold, but it also gets warm in the summer. Fall's beautiful with the changing colors. We have green during the summer, and then you see the beautiful fall colors of orange and yellows and that change, which is something unique for Minnesota. We have 10,000 lakes, as mentioned, with multiple activities and a great place to raise your family. What does it mean to be Minnesota? As I explained, we look at the birth to old age. We really focus on care and how we can care for our patients. We create these talent pipelines for you to understand what it means. So if you wanted to be a med-surg nurse, we're going to move you through, and you could be an ICU nurse, or you could change and start at medical surge and get into a specialty and do dialysis. You could do NICU. You could do multiple different areas. Health Fairview has diverse populations, diverse employees, and we look at all different types of healthcare. What that means is we're an anchor mission. Anchor mission pulls in our University of Minnesota, our specialties of UMP, and then Fairview Health Services, and we combine so we can transfer patients depending on whatever diagnostics you have, and we can move you to all of these different areas so that you get the best healthcare possible. So you heard that when you listened to the video and how we transfer care and work together as healthcare professionals. We do hold some organizational recognitions with our hospital association, the U.S. Department of Labor, and some of our White House initiatives to ensure that we can work with people and move forward for their care. Minnesota is seeing this large shortage for nursing. This is where the international nurse comes in. We're looking at 5,000 registered nurses each year that are going to have that shortage. And we really need to be able to balance our nurses with our patient populations and the diverse groups. We also have other areas in other than nursing. We have medical assistant, mental health providers, IT, lab, housekeeping, nutrition. These are opportunities that you could consider if you're bringing spouses with you or other family members. We do have those openings to offer your family as well. We're located, obviously Minnesota has the locations in Wisconsin and Florida, which are in another part of the United States, but we have rural health, cities health. We're spread out even with our Ebenezer sites. So each area is special with the communities that we serve and those populations that we serve. Our ethnicity, we have so many different opportunities. We have African American to Native American to Asian to East African to European to Hispanic. We even have our subcultures of LGBT, deaf and hard of hearing, blind, disabilities. We work with every type of population that you can imagine. We also have employee resource groups, which we call our ERG groups. These are communities that focus on the different cultures, and we celebrate these. These are super important to Health Fairview because that's what we call community. We're working with community connections and organizations to ensure that you have that support when you come here as an international nurse. We're recognized with our healthcare system with transplants, multiple transplants. We have multiple cultures with 92 different languages that we support, as well as we were the COVID designated hospital during the pandemic for Minnesota, which we set up within a month's time frame to ensure that our patients could be taken care of during that pandemic time. So nursing, we have areas and different levels of care, from emergency care, trauma, critical care, immediate care, medical surge, NICU, pediatrics. We provide, like I said, from birth to old age. It's a very exciting place to work. Our hospital situation is the chief nurse.
Oh, no.
What?
Oh, we hit the 10 minutes,
Oh, did we?
Tanya.
Oh, so we couldn't get to all of it with the problems or the
That's okay. You know, I want to hear in 10 seconds just one reason why you love working at Fairview, for both of you. The one reason. I know it's probably a lot of reasons, but just your main reason.
Okay, I'm coming back to you. The main reason is the opportunities to work here at Fairview, whether it's the benefits or whatever it is, it's the ability to grow within your profession. So I started as a nursing assistant and now I'm a provider.
Wow,
and that's what we are.
That's amazing. That's so great to hear. And what about you, Michelle? In 10 seconds, just why you love working at Fairview.
I love working at Fairview because of the passion that our physicians and our nurses have for our patients, and the partnership that Fairview is building with our people that we serve in our communities to help blend for better healthcare services for our people that we serve.
Amazing. Love that. Well, thank you both so much. That was so interesting to hear all about Fairview. I mean, being ranked America's greatest workplace for diversity in 2023 by Newsweek, that's a huge ranking. So that's pretty amazing. I mean, knowing that you were the COVID designated hospital, that obviously means for the state of Minnesota, a pretty big deal. Fairview must be a pretty big deal in Minnesota. I know you talked about all of the different opportunities and the different professional developments that your nurses have. So sounds like some amazing opportunities. Something else you actually didn't touch on, but that I was thinking about when you were talking about Minnesota is cost of living. You know, you're located right in the middle of the United States, and that's something that I think a lot of nurses really should take into account is cost of living. Very good cost of living in Minnesota. So thank you, Tanya and Michelle, for coming on and sharing all about Fairview. If you are interested in interviewing with Fairview, you can apply on our website, amnhealthcare.com/international, and our recruiters are on hand ready and waiting to slot you into the Fairview interview schedule that's coming up. So thank you, Tanya. Thank you, Michelle. Great to hear from you both.